Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob. I'm exactly one half of the Bob and Brad team, and today my guest host is
Mike Keenetz, physical therapist assistant.
And Mike is going to help me interview Rick Olderman, and we're going to talk about back pain, knee and hip pain, shoulder pain, and foot and ankle pain. So stick around.
Because you're going to realize everything's connected.
Right.
So the next book we're going to discuss is Fixing You Foot and Ankle Pain. So, Bob, you have the same question every time.
I know.
Who would benefit from this book the most?
I know.
Well, by now you should probably know my answer.
Right,
anyone who has not responded to traditional physical therapy or chiropractic or whatever approaches would benefit from this book.
Gotcha.
So according to your book, we have 6 muscles that move or help move the foot into dorsiflexion. So that means going up for people that are listening. But we have 14 muscles that help your foot move into plantar flexion. So what does that mean to you?
Yeah, so what does that mean? We have double the amount of muscles, right? And they're so much bigger that push us into plantar flexion, or those are the muscles that allow us to go up on our tippy toes. So the calf muscles, the soleus, and all those other guys, right? So we have double those amount of muscles. So if something goes wrong with those muscles, they are going to have a double impact on the foot and ankle than the muscles that are pulling us up. Does that make sense?
Yes.
Yeah.
Okay, so because we have twice the anatomy devoted to that motion must be pretty important in our bodies. And it turns out it is. And so what happens is, typically, to make it really simple, when we're walking, our body has to pass over the foot during foot strike. When that foot is on the ground, our body has to be able to come over it. Does that make sense?
Yes.
Right? All right, so the ankle needs to be able to bend for that to happen. If those 14 muscles are too tight, they're going to constrict your body's ability to come over that foot during walking. And your body will start to compensate. So if you remember when I talked back earlier about the force that our bodies generate, right? You turn around, you don't know something's there, you run into it, it's like you're hit by a linebacker, all right? So now you've got all of this force being directed through the foot and ankle. You've got a tight calf soleus and perhaps other muscles down there, and they're restricting that force from, you're trying to go forward, and they're saying no. So where does that force thing go? It's got to go somewhere, right, for you to move forward. Right. So there are 26 joints in the foot, right? So that force has 2 options at this point. One, it's going to be transmitted into the bottom of the foot and cause excessive compression and flattening of the arch. Or 2, the foot's going to say, nope, you're not going to find a home here. I'm going to push you back up to the knee. And so what it's going to do is going to throw everything back up to the knee, so then the knee moves into that hyperextension and irritates the popliteus muscle, turns off the gluteal muscles, and starts to break down and create that side bending problem. All right? So that's the significance of that architecture of the lower body, is that when something is wrong there, it has twice the impact of the dorsiflexors on our function. And the result of that is the easiest way for that force to disperse in our body is, frankly, to go through those joints in our foot. Because the foot is designed to flatten a little bit and come up again during walking. It goes down, the arch goes down and comes up, right? But when you now add this excessive force onto it, it goes down and it stays down. And that's when we develop plantar fasciitis, heel spurs, Morton's neuromas, bunions, all sorts of problems in the foot. Yeah, right? Because the forces are unrelenting, acting on those tiny little joints in our foot.
So in the book, you have the 5 biggest contributors of foot pain. So we're going to kind of break down each one, and if you wouldn't mind elaborating on each topic I ask. So the first one you talk about is foot strike or your walking pattern. So how does that cause foot pain for some people?
Yeah, so we've talked about that a little bit, and
Right,
and just
exactly.
now, as a matter of fact. So if your body, if your if your calf is tight and your ankle is not able to bend well, all right, that force is going to be distributed through the foot and cause all of these types of problems. However, if you're also not walking correctly on top of that, it's going to cause those problems, that tightness in your calf, to become magnified, all right, and cause even more problems. If you're walking correctly with soft knees and things like that, what that's going to do is naturally lengthen the calf and soleus complex in the lower body system. And those are the main drivers of foot issues. If you can lengthen those, because in order to soften your knee, it has to travel forward towards the toes a little bit, all right? Which means that the calf and soleus has to lengthen a little bit. So if you walk using that new, instead of locking the knee back, if you walk keeping a softer knee, now you're walking with lengthening happening in the calf and soleus as opposed to shortening happening in the calf and soleus. And it creates a huge deal.
Will it help to walk with a shorter gait pattern?
Initially, Bob, that's what most people need to do, because what's going on is most people have learned to walk with their foot way out in front of them.
Right.
And in order for their body to catch up to that foot, the opposite side hip joint and pelvis don't know how to do that, to allow that big motion to occur yet. So they need to start with smaller steps in order to start training the opposite leg to allow that opening to occur.
Sure.
Does that make sense?
Yes, makes sense.
So as it usually takes a few days. And then once you start seeing, oh yeah, okay, that's getting a lot easier for me. My body can travel, over my foot, even with long strides now, then you've got it. But it usually takes between 1 and 3 days for most people.
Gotcha.
So in the book, you also mention how the shape of your foot, in terms of how much pronation or supination you have, how does that affect people's foot pain?
Yeah, so, pronation, so our primary stabilizers in our bodies are our ligaments, all right? They hold all of our joints together and all that kind of stuff. So when we have a pronating foot, which means that it's flat, it means that your ligaments aren't doing the job that they're supposed to because they're too loose. Well, we can't, that's often a genetic thing. We can't train your ligaments to respond faster and be stronger, right? Because they don't have a contractile component to them. It's a passive structure, all right? And I describe ligaments like, if you saw an accident outside your window and that ambulance comes immediately, that's your ligament addressing the accident. Then 2 weeks later, when a doctor comes by and says, hey, was there a problem here? That's your muscles responding to the problem. So the ligaments are your first responders. And if they're compromised, you've lost that initial stabilization system. And the muscles cannot solve the problem fast enough for, when you don't have the ligament stability there. So with flat feet, what's going on is now you've got this, I just kind of describe it as a loose bag of potatoes, everything is just kind of collapsing a little bit too much, and you don't have the spring coming back again. Well, there's up to when we're running, we have up to 5 times our body weight passing through the foot and ankle with each step. With walking, I think it's around 2 or 3. So if you multiply your weight times 2 or 3 with each step and your ligament structure isn't there to stabilize things, now you've got all that poundage just pounding on other structures in your foot. And this is what leads to a lot of foot and ankle pain. But a lot of that is occurring because the whole gait pattern is wrong and the foot isn't, and nothing else is controlling your body when you're walking incorrectly. So you have no support from your glutes, from your quads, from your calves, from anything else to offload those lax ligaments in your foot. That's why foot and ankle flatness is a problem. It's a bigger problem if your gait isn't right, too.
Sure.
So do you want to talk about how the shape of your thigh bones can affect your feet and maybe cause pain?
Oh, that is such a great question. All right, so I'm going to have to use my skeleton for that one. I love that you asked that, Mike. So this is a really important concept. All right, so this is our thigh bone, all right? And our thigh bones are all built differently, all right, between person to person. There's something called femoral, this is the femur, retroversion, where the thigh bone is twisted outward slightly. And there are thigh bones that have femoral anteversion, which is a thigh bone that's twisted inward slightly, okay? Typically, females are more prone to have anteversion, or internal rotation of that thigh bone. Men are more prone to have thigh bone external rotation, all right? What matters with this is that we have to have, if you have an anteverted femur, and knowing that internal rotation really causes more compression and irritation to joints, then you have to control that thigh bone more if you have an anteverted femur. And so if you have an anteverted femur, or one that's rotated in, then we double down on our gluteal strengthening and gait correction to really make sure that that thing is not just doing this with each step, right? And if you go to a mall and you watch people walk, you'll see knees going in like this, and I'm just like, oh, that person is just breaking down their whole body.
Right.
So once you learn to walk correctly, that will now be like this, and it'll be more controlled, right? So how that affects the foot is this. When the thigh bone rotates in, and especially if it's uncontrolled, that will happen very quickly. And then the knee is rotating in. And then what happens especially is that then the foot is rotating in too, and pronating and flattening more. So if you can control the thigh bone rotation so it's not rotating in nearly as much, then by extension, you're controlling the amount of flatness that's occurring through the foot. Does that make sense?
Yes, it does.
Yeah.
Okay, now,
Absolutely.
femoral retroversion. All right, so I have some people who come in and say, oh, I've got supinated feet, right? And that means a foot arch that's too high. And so, but they don't have supinated feet. They got a retroverted femur. What's going on is that when the thigh bone rotates out, it wants to pull everything out with it. And if your foot is pointed, you can do this just standing up. If you kind of stand with your feet pointed forward and then you squeeze your butt and feel your thigh bones rotate out, you'll feel that your arch lifts off the floor, right? It looks like it's supinated, or you have a high arch. You don't have a high arch, naturally though. The high arch is coming because you are not aligning your foot position with the shape of your femur. People with retroverted femurs need to point their feet out slightly. All right? And when you point your feet out, you'll notice that there is significant tension that reduces throughout the whole lower body chain, including now your foot isn't supinated any longer. All right? It gets to move through the normal way it's supposed to. Now, why aren't people doing this? Because invariably, when I say, hey, you need to point those toes out just a little bit because you've got retroverted femurs, people say, you mean I have to walk like a duck? So what we've done is we've socialized this idea that all feet should be pointed forward.
Right.
And they shouldn't, because we're not all built the same. And this is also evidenced when you see a guy sitting down and they've got that man spread, right? The knees are way apart.
You can't see my legs,
Right?
but that's what
Right?
I'm doing.
Exactly. Because that's due to retroverted femurs. The thigh bone is rotated outward. If you put those knees together, Mike, go ahead and put your knees together.
Oh, it's
You'll feel that
uncomfortable.
takes a significant amount of effort. Right. It takes a lot of effort. So in order to do that, you're then overly activating all of the adductors of your leg, which creates a whole nother set of problems. Okay? So better to understand that, oh, I've got retroverted femurs, I'm allowed to walk with my feet out. And I'll tell you that I saw an elite cyclist knee pain. He had a big race coming up with just that one solution. I didn't give him any exercises.
Sure.
I said, look, rotate your cleats out 3 degrees. Let your knee fall away from your bike frame about a half more inch than you're used to. And he was to the point where he couldn't even ride 3 miles. That weekend he went out, rode 50 miles.
Wow.
No pain at all. All because we understood the significance of the shape of his thigh bone on his knee, foot, whatever. Okay? This is why solutions appear very simple when you understand things from a systems standpoint. Because you can make one small change, but it's like a ripple effect throughout the whole body, because that's how we're built to work.
So if someone, say like me, wanted to run, which I do sometimes, and I am more retroversion, I don't run in a retroverted state. I run straight feet. I mean, I have pretty flat shoes, but should I try to retro or turn out my toes?
Yep, turn out the toes. Just try a degree or two. A tiny. How far do you run typically, Mike?
Well, I just did 2 marathons, so.
Okay, so long distance. Okay,
Yeah.
so this is a really good point. Do we want to make a 2-degree difference in your foot rotation when you're running 26 miles right off the bat?
No.
No, because your body hasn't adapted to that change. So what I would do is start with that recommendation for short runs. And even like maybe every half mile, turn the feet out a little bit, see how that feels, and then go back to your foot turning in. And start experimenting with what degree of turning out feels best for your legs. Because your degree of retroversion won't be the same as my degree of retroversion, right? It won't be the same as Bob's or anyone else's. So you've got to figure out that perfect angle of your foot on your own. But giving you the permission to turn that foot out and experiment with that will probably change your life in terms of your running path. Because when the foot gets to rotate out, guess what gets activated better? The glutes.
Glute max. Yeah,
because they are external rotators of the lower body. Now you're externally rotating that leg. It's biasing the glute maximus to turn on now. So you get to recruit more of that because of that change.
Yeah, with the distance
You'll
running,
find more
I noticed
power.
with keeping my foot straight, my glute meads get the most sore, and one of them was actually pretty problematic this last training route. And I've been trying to figure out why, and I'm assuming that's why now.
I bet you're right.
It's if it's not the only reason, it's probably one of the big reasons.
Yeah.
So I saw this in your book, and I had my daughter do it, and it took away her foot pain.
Great.
Walking.
Isn't it so simple, Bob?
You had her just
It's
turn
so
her
simple.
toes out?
Yep.
Oh.
She naturally turns out her toes.
Yeah, I understood that with like trying to fix my squatting
She
mechanics.
was trying to walk with her feet straight.
Yeah. Huh. Well, we'll have to tell Brad because you always make fun of him for that.
I know.
Yeah. No, we don't have to tell Brad. You can keep that a
That's
secret.
right.
So interestingly, I have my own little podcast, not nearly like your guys's. I just started it, and I interviewed Dr. Shirley Sarman on there. And one of the comments that she made, one of the comments that she made was that more and more females are developing for more retroversion.
Really?
And I thought that was a really interesting comment. So what that does, either we're measuring it more and finding a level of retroversion that we didn't know existed prior to that,
Right.
or the retroversion is in part consequence of training strategies. Because a lot more women are becoming, entering athletics and becoming stronger and stronger, and pushing themselves really hard. And that may have some adaptive influence on the degree of retroversion and anteversion as well. So that would be an interesting study for those of you who want to do research.
Sure.
I guess the last biggest contributor of foot pain you have in your book is foot muscle dysfunction. Would you like to elaborate on that a little bit?
Well, you can talk about. Okay, so the foot pain book is the one that I've departed from the most of all the books that I've written, because I've learned so much by owning my clinic, and solving foot issues are so much easier than how I present it in my book. So you don't have to exercise the foot muscles. Really, what it comes down to is understanding. Really, it's the calf and soleus, right? So if you can solve the calf and soleus tightness, and that degree of force that's driving into your foot, that will solve almost all of your foot pain. And so one of the ways to, if you're in a lot of pain with plantar fasciitis, in my home program, downloadable home program for foot and ankle pain, I have a taping technique that is unique to my approach that will correct the arch of your foot and eliminate a lot of the stresses that are going through that arch until you start to learn how to walk better and solve the reason the arch is collapsing in the first place.
Great.
So taping is a great bridge while you're in pain to allow everything to calm down and while you're improving your function. And then you wean yourself from the tape. And I do that all over the body. Tape is a big help. It's featured in all of my home programs because it gives us a window to see, what would my body feel like if everything was working perfectly? And usually people say, it feels wonderful. Okay, great. Now we have to get you to do what the tape is doing. And that's what my programs do.
Do you use K-tape?
No, I don't. KT tape is too stretchy. So I use KT tape with things that don't need to be controlled well. Maybe if we're trying to guide a movement, but if we're trying, like KT tape will never hold up a shoulder blade. All right. Now, if someone has, an allergic reaction to the tape, then I'll use KT tape with apologies. Nothing wrong with KT tape, but for the things that I'm trying to control with the way I approach things, KT tape will never hold up a foot arch because you've got, 2 to 5 times your body weight compressing through that foot arch. Well, it's too stretchy. It just won't do it. So I use Leukotape P and Cover Roll Stretch.
Gotcha.
And those are the ones. Yeah, those are the ones that they're like iron, and they will stay on for a week. Yeah. So KT tape I found useful for things that I want to guide. Leukotape P and Cover Roll Stretch for things I want to control.
Okay, we got one last question on foot pain. Can you just give us your thoughts on foot orthosis or arch supports?
Yes. Oh, great. Yet again, Mike, another great question. So what I have found, I don't know if you guys have taken foot orthotics courses, but even in PT school, when they teach us about foot orthotics, all right, they show you all the science behind all the orthotics and everything like this, and then if it doesn't work, then you can start posting here and posting there. I'm just like, well, where did all the science go then? If we have to learn all this science around the shape of the foot and how the foot orthotic should be controlling it, then we shouldn't have to post because we've done the foot orthotic correctly in the first place.
Right.
So what I've learned in my years is that foot orthotics are based on this idea of subtalar neutral. So the foot orthotic, subtalar neutral is a position of your foot and ankle whereby everything is supposedly aligned perfectly. It's the ideal position. And so foot orthotics are casted in that position. The problem is that when you then step on the foot orthotics, you're now falling below subtalar neutral, below the ideal. And so what I have learned, I found Soul Supports. I don't know if you guys have heard of them, but Soul Supports teaches a method to cast above subtalar neutral, so that then the foot falls to subtalar neutral and then back out again. So we're not hanging out in this area below subtalar neutral where damage occurs. We're hanging out above it and going to it and then getting out of there again. All right? And so I think I've been casting for them, and they're not paying me for this, but I've been casting with them for about 15 years. I think I've had one pair of orthotics that someone has returned because they weren't happy with it.
That's unusual. Really unusual.
And so what I did was I developed my taping technique based on their casting technique because it was so successful that I thought I've got to learn to tape a foot like this because I don't think all these people need these orthotics. And so lo and behold, what I found was when I taped the foot and I fixed the system, 95% of the people who are asking for orthotics when they enter our clinic do not need the orthotics because we
Right.
fixed the system problem. The only people who need the orthotics in my practice were the people who were very hypermobile, had very loose ligaments, couldn't control their joints worth a squat. Everything was collapsing. Even with strengthening, it would collapse. And so those were the people who did best with orthotics.
Well, we're going to stop there, Rick. You've been very generous with your time. You want to give your website one more time?
Oh, sure. For my downloadable home programs, go to fixingyoumethod.com and then type in Fixing You, all one word, and you can get a 20% discount. And then if you're a practitioner, you can go to healpatientsfaster.com and you can learn this systems approach to solving pain. And if you want to look at some of the other stuff I've written or blogs and all my programs and everything is found at rickolderman.com if you just want to peruse everything else that I've got there. Yeah.
Yeah, this has been fascinating.
Yes, we learned a lot about many different
Right.
subjects and body parts.
Th-
But they're all
I
connected.
could talk for days. They are.
Well,
Yeah.
Thank you for joining our program.